Hola todos. Hello world. It's great to see you again on a webinar Wednesday. Today we have the great pleasure to speak with Dr. Zacarias. Dr. Zacarias is associated with the Organización Dominica de Estudiantes de Medicina. For everybody who doesn't speak Spanish, that is the International Federation of Medical Students Associations. And she is now based in Santo Domingo in the Dominican Republic. And just for everybody else's sanity, I will be conducting this interview in English. Lo siento, Dr. Zacarias,
No
but
worries. No worries.
like nobody wants to hear my Spanish. It's pretty bad. But it's so nice to see you. Thank you very much for joining us today.
Thank you for the invitation.
My pleasure. So for the benefit of everybody, the vast majority of the audience in these webinars is really people who want to make a difference in One Health, people who want to learn more about One Health, people who want to think outside of the box, outside of the house, outside of the country, right? So Dr. Zacarias is in the Dominican Republic. She's a medical physician, a human doctor, whereas I am a animal, other species doctor. And that's just one of the wonderful examples of how we can have One Health conversations. That's a little bit of background, but let's just dive in and hear, how did you become associated with this wonderful organization? Where are you now? Are you teaching in a school? All of that. I'll leave that to you.
Thank you, Deborah. Well, thank you for the invitation, and actually it's a pleasure for us to be part of this webinar series. And to answer your questions, well, throughout my medical school, I always encounter myself with many doctors and physicians that I looked forward and looked after, such as Helena Chapman, for instance, and Dr. Eddie Perestan. Both of them have this particular background on global health, and in some ways, these serve as a link between medical schools, medical associations, and many other institutions that work in the terms of global health and also One Health. So after that, after getting to meet them and actually seeing what they do for a living, for work, and to help incentivize this great topic into our medical schools and many other institutions, we got into the Organización Dominicana de Estudiantes de Medicina, and currently here I'm serving as the president of this term 2021. And after that, I just kept on trying to incentivate and creating awareness in our members about One Health, because that's what I learned. And I know that also with the help of these two great doctors, and also with the help of One Health lessons, we can do a great job here in Dominican Republic as well. Because the truth is that our medical schools, they don't touch the topic as it is, not with the relevance that it has. And seeing the deficiency in that area, we wanted to bring this relationship between both of organizations to the common knowledge, and then our members will go and learn more about it through webinars, through many other activities that we can do together. But the sense is, or the most important thing is that we need to work together to actually improve this awareness in One Health and understand its relevance.
That's fantastic. So sounds like you're an educator in the DR, in the Dominican Republic, and you're teaching students about One Health.
Yes,
when you were a student, yeah. When did you first hear the term One Health? When did this actually come up for you as an individual?
One Health came actually maybe in my 4th year of medical school, and it was in a class called Social Determinants of Health. And well, through that, they started mentioning how one's self-health is actually impacted not only by the physiological changes that may happen in the individual, but also by the environmental changes, and also what we interact with, such as the veterinary world, the fauna, and many other factors that intervenes in a person's health. So that will be translated into One Health. It's actually the health of everybody, the health of everything, it equals to oneself as well.
Right, right. So 4th year of medical school. That's a lot sooner than a lot of people.
Yeah, actually, this is a new school, is O&M Medical School. It only has like 13 years running now, and its expansion was mostly influenced by global health and One Health as well. So we did have the opportunity to encounter ourselves with many themes related to this important topic. And so my promotion, my class, they are really aware of this, but this isn't the case of the majority of our medical school students here in Dominican Republic. So we would like to translate that into the other education's institutions as well.
Great. And so what has been done so far in the Dominican Republic with the One Health space? I know that back May 1st, there was an event that the America's promotions intern, Kari, participated in Spanish.
Yeah.
And it was a wonderful event. She was.
Yeah, it was really nice.
So can you please share with this audience today what was involved? What have you been up to?
Well, that was a great activity. Actually, many of our students loved it, and they will love to see it happening again. Carrie did a wonderful job. Also, Caridad was there, and they basically just shared the basic topics about One Health, just to start with, because we know that we have a population that maybe aren't as familiar with the topic as strongly as we might be. So we began with the basis of it, how is it related with everything or any other of the factors that encompasses One Health, the three spheres. And then after that, we made some scenarios, or well, Karen Caridad showed some scenarios in which we as physicians or physicians in training may help to improve the awareness and also to utilize it in our clinical practice as well. So it was really great. We got great feedback as well. So what can I tell you? We are really thankful of that collaboration because it served well.
Wonderful. I'm really happy to hear that. So, I don't know about you, but whenever I speak with medical students, I love it. Have you had the opportunity yet to speak with veterinary students? Or
Not yet.
Not yet.
Not yet, but actually we're working on making an association, rather a link with the organization ODEM, or Organización Dominicana de Estudiantes de Medicina, and la Universidad Nacional Federico Enriquez Ureña. This is a university, a national university that has a veterinarian class because we don't have many, but we want to make the link with them in order to incentivize, especially that the One Health part of our global health.
I think that's incredible. I think
well, hopefully it will go well.
I'm sure it will go well. I'm sure it will. And any opportunity that you and I and the other One Health advocates out there who are in educational positions, or, you know, I think the more diverse audience we get to, the more we can bridge rising leaders in the One Health.
It broadens our scope, definitely. And yeah, I really believe in that. And I think that as many interactions, as many contacts that we can get, we can actually spread the word easily, hopefully. Actually, one of our plans as well is to try to make a link with the Ministry of Education here and see if we can get to the maybe 13 and 18 years of age population that are still going into the school, to see if we can maybe plant a seed about One Health in this population and make a cultural change. Because the reality is that we need to start with the little ones if we want to see a great change in the near future.
Right. And that's the purpose of One Health lessons. So you are more than welcome to use all of the lessons that are on onehealthlessons.com has been translated into Spanish. So they are really accessible. Use them as you will in the DR and let us know how it goes.
That's really great news, actually, because yeah, the language may be a limitation, and now that it's in Spanish, well, there's no barriers at all.
No
Thank you
barriers.
so much.
Print it out, and would love to hear a blog post or read a blog post about your experience there. That's
For
wonderful.
sure.
So going
Yeah.
forward, do you see students, medical students who plan to go into clinical medicine, do they, I don't want to say appreciate, but do they acknowledge how One Health can play into clinical medicine, into the hospital on a daily basis? And if so, any stories with that?
Well, actually, yes. I do think there's many students that appreciate this insight of One Health into their professional area. For instance, we have this very significant issue with garbage disposal, for instance, just to name one. And we are in an area that is really prone to rains. So these two factors together, they make a suitable environment for mosquitoes to grow. And then we have a burst in the at least 2 to 3 outbreaks we have in a year of dengue fever, for instance, because of this. So there's many factors that intervene in that, not only the environmental, but also the cultural, because these are same population that is not organizing well their garbage, and they are just throwing it to the street and potentiating this breeding of mosquitoes and then getting our population sick. So recognizing that our medical students and doctors in training that are working in the countryside or at the hospital, they see this at first hand, and they have to do kind of an educational intervention as well. After they treat the disease, they have to do an educational intervention, trying to see if we can prevent these outbreaks coming over and over yearly. It has been better after 2014, but still there's a lot that we have to work with in this area, because again, it's also a very important cultural factor that we have intervening here. But we do see the relevance of One Health in this scenario particularly.
That's that's really interesting, and it's great to hear that clinicians are taking the step beyond after they have diagnosed.
Yeah, the cure or what will help with this obviously will be prevention. So that's why we're trying to intervene with an educational campaign. But at the end of the day, we also see it translated into a disease at the hospital because of these two factors, environmental, if you will, and also the person itself. Yeah.
Right. If I can ask you, we'll dive into. I don't want to isolate certain parts of the audience. So what I'm going to be asking you next is about a soap. So for everybody who's not in medical anything, like no nursing, no human medicine, no veterinary medicine, SOAP stands for subjective, objective, assessment, and plan. And that's how we as clinicians can evaluate a problem and work through the process to then diagnose and treat.
Direct.
So in your subjective part, that's where we typically write histories, we ask questions. For me, it's asking questions of the owners. For you, it'd be asking questions of the patients, as long as they're verbal, not incredibly geriatric, style or pediatrics, right, or babies. So in the subjective part, I'm curious, do you ask things, or do you train the rising stars in human medicine to ask if there's any pet at home? Is there any connection? Can you explain a little bit of that? Because I'm personally really curious.
Yeah, that's a really great question. Actually, yes, we do ask about pets in the house, especially if they are being follow up with a veterinarian. How integrated are they with the family if there's more than one person living in the house? How do they treat their soils, or where do they sleep in, stuff like that. Also, if vaccination is scheduled, if they are receiving any vaccinations. So yes, we do inquire about that to rule out any let's see, close relation with their health, because there's certain diseases such as, or infections such as lysis, or bedworms that we may see in the clinical scenario, and then we have to investigate what exactly may be the source of it. And most of the time is because they don't know, or they are unaware of how to treat their pets and keep them healthy as well. So you see it's a bi-directional situation. They don't treat their pet well, they don't keep them healthy, so they get sick. Or the person itself won't take care of themselves, and they may be a potential source of infection for their pets if their relation is very intimate. And that will depend on the degree of their relationship as well. But we do inquire about that.
Interesting. Yeah, from the veterinary point of view, what I always do is I
Mhm.
ask, I know it sounds silly, but I ask if the patient in front of me is an only child, only four-legged child, or are there two-legged children in the house? Because if there are toddlers there, I need to know if I'm going to give a topical on the skin medication, I need to know what can get their hands on that, right?
For sure.
So it's a two-way street. And I think what you're doing with the young leaders coming up in human medicine, training them to see not just the patient, but the surroundings,
Correct.
really important.
Exactly.
Yeah.
Yeah.
Yeah. There are so many not only diseases, but conditions that are related to our environment, right?
Yeah. Most of the time we don't acknowledge it, but our health is very well impacted by everything that we touch, everything that we smell. But we can take COVID as an example here. Actually, is in any surface we can encounter particles that may infect us with COVID. So we don't see how the environment is actually serving as a vector here.
Right, right. Well, this has been really enlightening. How can people who are hearing this in the Dominican Republic or in surrounding countries contact you if they are interested in what you're doing and they want to learn from you and replicate what you have been doing in their own communities? What do you recommend
Yeah.
going forward?
Well, they can get in contact with us through our organization. We have a Gmail, which I can lend to you, and maybe you can just put it in the description of this video. Yes. And also we have our social media, so they can get in contact with us very easily. And if they want to contribute and keep on helping us to incentivize the importance of One Health in any other aspect, if you come from the veterinary world, I come from the clinical human world, then yes, it will be great and well received. And also, if they want to learn as well, they can easily come to us, and they will have the opportunity to get involved and learn more about One Health. And for sure, we will share that the many resources that you guys are putting into our plate right now. It's in Spanish, it's in English, so that's very well. That's a great option. So yeah, and if they want to keep on doing this, I think that or what at least what we've been doing is to get in contact with any other organization that share our values, such as you guys, One Health Lessons, and just keep on working together, because this is a team effort. We cannot work individually and acting in our own ways. I mean, we can learn so much from other institutions and other persons. So we just got to keep investigating and finding wonderful people such as you guys that are working for a better world. So I will say that.
Well, thank you very much, Dr. Zacarias. There you go, everybody. Straight from the mouth of Dr. Zacarias from Santo Domingo in the Dominican Republic. Muchas gracias, Dr. Zacarias. This was wonderful.
It was a pleasure. Thank you for the invitation again. It's a
My
pleasure.
pleasure. See you next time, everybody.